Vyvanse is the internet's favorite ADHD medication. Just check out TikTok, Reddit, or the YouTube comments section. Everybody loves it. But do I think it's the best? No. And I'm gonna explain why 50% of the people that do well on Vyvanse actually would do better on methylphenidate. My name is Jonathan Murphy, psychiatric nurse practitioner. I've been prescribing ADHD medication and treating adults for a decade. Let me tell you what I see in my practice. So, you're on Vyvanse, you love it, makes you feel good, you tolerate it well, and you have a good effect. That's great. That means it works well for you. But that doesn't mean it's the best, and it doesn't mean it's the best for everyone. At the end of the day, every medication regimen is optimized, meaning we want to find the right amount of stimulation for each ADHD brain. The diagnosis tells us what group of medications to choose from, but not which one is the best. To break it down simply, about 50% of people do best on a Adderall or something similar, while the other 50% do best on a Ritalin or something similar. And here's Vyvanse dominating the conversation. What's going on? So let's remember something. All the stimulant medications, Adderall, Ritalin, Focalin, Concerta, Vyvanse, they all do the same thing. They activate dopamine in the brain. Hit a little button that provides stimulation that is not consistently there in an ADHD brain. Non-stimulants do this too, but to a lesser degree, and that's just not going to cut it for most people with ADHD. But it will for maybe 2.5 to 5% of the adult population that I treat. Here's the thing, if the diagnosis is accurate, it tells us with a very high degree of predictability if the medication is going to work. Meaning ADHD symptoms being treated, ability to start tasks, following through with things, sustaining attention until a project's done, being able to sustain attention in boring environments, the list goes on and on. Finding those benefits is 90% of it. The other 10% of it is dialing it in to ensure optimal toleration and that the patient doesn't feel different and notices nothing other than feeling like themselves and the symptoms are treated. And otherwise, it's all good and no bad. The reality is, after assessment of initial response, it just comes down to finding the right chemical. So why do people love Vyvanse? Well, here's what I see clinically. Everyone knows about Adderall. It's the most popular and well-known medication. It's taken the spotlight away from Ritalin in recent years. So at a psychiatrist's office or another nurse practitioner, or maybe even the primary care provider will start with Adderall XR. But amphetamine provides the most amount of stimulation, and Adderall has two types of amphetamines, D and L amphetamine. The L amphetamine is 25% of an Adderall XR capsule. Because it is the most dopaminergic or dopamine activating stimulant, amphetamine is simply too much for some people. So where does Vyvanse come in? Well, hey, it ain't your grandpa's amphetamine. So the medication has a fancy pro-drug way of working. You take the medication and it gets in your bloodstream and then it has to activate. And when it converts from lisdexamphetamine to dextroamphetamine, well, you're still taking 75% of the same thing that Adderall has. So is it the 25% of levoamphetamine that causes someone to have a poor response with Adderall XR and then do great with Vyvanse? Not what I think. There shouldn't be a difference from Adderall XR to Vyvanse of so much better. That would tell me you're just having a smoother ride, but it was probably too bumpy in the first place. Sometimes people switching from Adderall XR to Vyvanse is going to work really well, but the side effects people are experiencing are mild. They're not more than something that's minorly uncomfortable, maybe dry mouth, maybe mild jitteriness, not anxiety, not agitation, not overstimulation. For some people, Vyvanse is the right medication, but not the majority. So what the assumption is, the treatment of their ADHD symptoms happens to come with mild overstimulation and anxiety. Not the case. So if you're white knuckling it, feeling overstimulated, managing side effects, you're not on the right medication. Vyvanse might be better than Adderall for you, but that doesn't mean your medication regimen has been optimized. So what I'm saying is the rate of Vyvanse approval is just a little overinflated because you're not accounting for the people that would do better on methylphenidate that aren't prescribed methylphenidate and don't know about it. Why does methylphenidate get overlooked? I'm not sure when I talk about it. Many people ask me, so what does it do? Is it still a stimulant? And I have to educate them and let them know, yes, it's still a stimulant. It still provides direct agonism or stimulation to the dopamine receptors, just not as much. So if someone has baseline anxiety or panic, has shown sensitivity to other medications or stimulants, I'm not going to go with a lower dose of Vyvanse or a lower dose with Adderall. I'm going to go with the adult starting dose of methylphenidate. Someone on the autism spectrum, they're going to do best with methylphenidate 9 times out of 10. And when people people start with Adderall and Vyvanse and land on it, I always make sure people understand and are given robust education about their options. Because I don't want to get into a situation like I've been in before where someone's riding it out with Adderall XR or Vyvanse for years before finally switching to Concerta or Ritalin or Focalin and looking at me and saying, I don't know why I didn't do this a long time ago. But is it really so big of a deal? Is it really worth making a whole video about it? I think so, yes. Not only will people do better individually, but if the right people switch to methylphenidate, it will free up the larger supply of amphetamine, which has had shortages since COVID-19. And then there's the cost factor. It always pains me to hear when someone's paying more than $150 on an ADHD medication just because the internet told them to. If you feel like Vyvanse has to be the one, make sure you've tried methylphenidate options as well, because they're much cheaper, and the best thing about a methylphenidate is you can really dial in the duration. The difference between dexmethylphenidate and methylphenidate are two completely different chemicals, whereas the difference between Adderall and Vyvanse is 25% difference. So Vyvanse and Adderall are almost the same thing, just the inclusion of levoamphetamine in Adderall as opposed to Vyvanse, but chemically it's 75% the same. In the methylphenidate side, you can dial in the duration using all these different combinations of capsules I talk about in other videos. Long-acting 50-50, you got Metadate, you got Aptenzio, you got Jornay PM. But if you're on Vyvanse or Adderall XR and you're struggling with overstimulation, try methylphenidate instead. Should you believe the hype about Vyvanse? No. Who needs the trendy thing when you can have something that works better and is cheaper anyway? But regardless, the most important thing is you're working with a provider that understands how to optimize your medication regimen. Go ahead and check out my medication playlist if you want to learn about what I do to help you work best with your prescriber to find a medication regimen that's going to be all good, no bad. And if you want to check out a really goofy video I made about all the methylphenidate options, check it out right here. It's my Halloween special. And go ahead and hit subscribe if you want to keep receiving practical strategies from a nurse practitioner who won't sell you short.